Hello everyone. Today I'm going to talk about two essential tools in preventive dentistry, hand scaling and ultrasonic scaling. These techniques forms the cornerstone of effective periodontal therapy and plaque control, help us to manage and prevent the gum diseases. While both of the method aims in removing deposit from tooth surface, but they differ in technique, efficiency and patient experience. Now let's talk about hand scaling. Hand scaling uses a special design manual instrument called hand scalers. These tools are used to scrape off the plaque and calculus from the surface of the tooth. It is a traditional and most effective method of removal of the plaque and calculus from the tooth surface. It is used for sub as well as supragingival calculus removal, and it gives the dentist better control and is used in fine dentistry. This instrument is known as cumine scaler, also called universal scaler. It has two ends. This instrument is used in removing moderate to severe calculus and used in removal of supra as well as subgingival calculus. One end is used for the breaking of the calculus and plaque, while the other end is used to scrape off the calculus and plaque on the surface of the teeth. This instrument is known as surface scalers. It is a two-ended instrument used for the removal of supragingival calculus. This instrument has two ends, in and out. The outer end is used for the removal of the calculus present on the mesial aspect of the tooth. This is the outer end, which will be used for the removal of calculus present on the mesial aspect of the tooth. It's called anterior jackweight scaler. It is designed for the anterior teeth. It has a straight working end, and which help us to remove the calculus from the narrow and tight front teeth, and also scaling on the lingual aspect of lower anterior teeth. This is the anterior teeth. Now we'll engage and we'll remove the plaque and calculus. This instrument is known as posterior jackweight scaler. These are designed for the posterior teeth, and it has a more curved and angulated shank. It gives us better access to the mesial and distal surface of the posterior teeth. We will engage the instrument interdentally, and then we'll scrape off the plaque and the calculus. This is the anterior sickle scaler. It is used for the anterior teeth, basically for the tight and narrow areas of the front teeth and also the lingual aspect of lower teeth. We will engage the scaler interdentally and remove the plaque and the calculus, used for anterior teeth only. This instrument is called large sickle scaler. It is used for the broad surfaces of tooth and effective for the bulk removal of supragingival calculus. It is basically used for the buccal and lingual aspect of molars and premolars. This instrument is used for the buccal and lingual aspect of molars as well as premolars. This machine is known as ultrasonic scaler. It is a type of piezoelectric machine. Now let's talk about the parts of ultrasonic scaler. This is a control unit which is used for adjusting the power and the water flow. This is the handpiece which is used to hold the tip and deliver the vibrations. This is a scaling tip which is used to remove the plaque and the calculus. We have a water source which is used to cool the tip and flush the debris. This is a speedometer which is used to adjust the speed of the vibrations. At last, we would like to say that scaling is essential for maintaining oral hygiene by removing plaque and calculus to prevent gum diseases and tooth loss. Thank you.